Hello everyone, we are Group 7 from Section D and we are going to discuss tuberculosis with the following objectives. So what is tuberculosis? Tuberculosis or TB is a potentially serious infectious disease according to the World Health Organization because it is one of the top 10 causes of death and the leading cause from a single infectious agent. The etiologic agent of TB in humans is Mycobacterium tuberculosis, which is a large, non-motile, rod-shaped acid-fast bacteria. It is also an obligate aerobe, that's why in classic cases of tuberculosis, it is always found in the well-aerated upper lobes of the lungs. The bacterium is a facultative intracellular parasite, usually of macrophages, and has a slow generation time of 15 to 20 hours, a physiological characteristic that may contribute to its virulence. This is the reason why in detecting TB, sputum specimens must be sent for culture and drug susceptibility testing for some time before starting treatment. Mycobacterium tuberculosis is spread from one person to another through tiny droplets that are released into the air. When a person infected with TB coughs, sneezes, speaks, or spits, they propel the TB germs into the air. When a person breathes in the TB bacteria in the air, the bacteria can settle in the lungs and begin to grow. From there, they can move through the blood to other parts of the body, such as the kidney, spine, and brain. All age groups are at risk, but adults are mostly affected by this disease. The risk of having TB is greater for those with weakened immune systems due to immunosuppression and malnutrition that can be brought about by poverty, smoking tobacco, drinking alcohol excessively, and using prohibited IV drugs chronically. Manifestations of having TB may vary depending on where in the body the TB bacteria are growing. Since TB bacteria usually grow in the lungs, symptoms such as a bad cough that lasts 3 weeks, pain in the chest with breathing or coughing up blood or sputum, are usually seen. Other symptoms of TB include fever, weakness or fatigue, unintentional weight loss, loss of appetite, chills, and sweating at night.
Tuberculosis is a curable and preventable disease that can be treated by taking several drugs for 6 to 9 months. A standard 6-month course of 4 antimicrobial drugs, namely isoniazid, rifampin, ethambutol, pyrazinamide, that are provided with information and supported by a health worker is used for the treatment. A person undergoing treatment for tuberculosis should be very compliant in taking drugs exactly as it is prescribed. Otherwise, the treatment will not be effective and the bacteria will still be alive and mutate, becoming resistant to tuberculosis drugs. Multi-drug resistant tuberculosis, or also known as MDR-TB, is harder and more expensive to treat, since the tuberculosis bacteria already mutated and have resistance against the 2 most potent tuberculosis drugs, isoniazid and rifampin. In cases where there is multi-drug resistant tuberculosis present, a combination of antibiotics called fluoroquinolones and injectable medications such as amikacin or capreomycin are generally used for 20 to 30 months. But some types of tuberculosis are now developing resistance to these medications as well. Primary prevention aims to prevent disease before it occurs. This includes eating healthy foods, exercising, and practicing good hygiene, such as hand washing. In places where there can be exposure to tuberculosis like in hospitals, environmental control by having UV lights and proper ventilation is implemented. Vaccination of the basal calmette green, or also known as BCG vaccine, is also highly recommended for immunization. Secondary prevention aims to detect early disease and prevent it from getting worse. One of the ways where secondary prevention is seen is through the detection of the latent TB infection via tuberculin skin test. Quantiferon TB Gold, or QFTG, is a blood test which can also be used to measure a person's system reaction to bacteria that causes TB. Another is by receiving a chest x-ray and a focused clinical evaluation to further determine the severity of the disease. Medications such as INH and RAF are also included. Tertiary prevention is for the people who already developed the disease. Its goal is to improve the patient's quality of life. The treatments used for people with active TB depends on whether the TB is resistant to some of the standard TB medications. It can take 6 months or longer. Directly observed therapy is done to make sure that patients take their TB medications. This includes a rehabilitation program wherein there is a close cooperation between all the members of the staff to provide quality care for the patients and prepare their return to their homes.